The first World Health Organization Africa Forum has officially kicked off in Kigali in Rwanda. It is taking place under the theme Putting People First, the road to universal health coverage in Africa. The two-day forum aims to promote and reinforce countries' healthcare governance. Delegates will also explore ways to partner and contribute to redirecting the work of the World Health Organization in Africa. Participants include ministers of health and finance from various African countries, as well as UN and intergovernmental agencies, academics and civil society organizations. The regional director for the World Health Organization has stressed the need for different sectors to work together to provide accessible, affordable healthcare for all on the continent. Well, let's get more now on the World Health Organization Forum in Rwanda, and I'm joined by CGTN's Lonella Lupuwana. She's live for us in Kigali. Lonella, what can we expect, though, from the first day of the forum?
Hi there, Beatrice. From this morning's opening remarks, we heard from Minister of Health here in Rwanda, as well as the Regional Director of the WHO in Africa. Her name is Dr. W.H.O. They both stressed the need for funding and partnership within different sectors to help boost accessibility as well as affordability within the healthcare system. Now I'm going to bring in Dr. Rwanda, who is the Communicable Diseases Regional Director here in Africa, to tell us more about what to expect from this first day of the summit. Thank you so much for joining us, Dr. Rwanda. What can we expect from the rest of the summit here in Kigali?
We expect to be able to agree on a call to action on how this continent is going to move forward to achieve universal health coverage. The forum, as you know, is bringing together people from different sectors, from the private sector, civil society, academia, the United Nations, agencies, governments, ministers, and different sectors from the government, not just health, but also ministries of environment and other sectors, for us to collectively look into what needs to be done, what are our challenges, and how can we work together in partnership around WHO, but most importantly around the ministries of health, around governments, around our countries, to achieve universal health coverage, which is probably a difficult term to understand, but that essentially means getting healthcare close to the doorstep of every citizen as much as they need it, but also not curative care. We think more often than not that healthcare is about when you are sick and you are being treated for a particular disease. We are talking about promoting good health. We are talking about people taking care of their own health. We are talking about preventing illnesses so that, or risk factors of diseases, so that we can minimize on the costs of treating people when they fall sick.
Now, we've seen vast and often tragic examples of why we need such forums to come together. Why is this one taking so long?
This forum is not taking so long. If you think that the Sustainable Development Goals were approved and endorsed in 2015, the year when Dr. W.H.O took office as the first female regional director elected for W.H.O Afro, we had to think through. We had to look at what does this mean, the SDGs, particularly the SDG 3 for health. What does it mean for our region? What does it mean for us to embrace the other SDGs so that we can give the best for the people in our continent when it comes to health? Last year, in December, we hosted a meeting which brought together different ministries of health and different cadres of the Ministry of Health to reflect on what universal health coverage would mean for the African region. We took those insightful discussions that happened in Namibia, in Windhoek last year, and then we put that together. We bounced it to other people outside the WHO Afro to gather ideas so that we could now come for this meeting prepared for discussions that will, like I said, take us to a call of action which hopefully will be endorsed by everyone who is attending this meeting and will lead us to put us firmly on a path to universal health coverage in our region and achieving the Sustainable Development Goals by 2030.
You'll agree with me, Doctor, that this meeting is the first step of reaching your goal. For the people that don't have access to healthcare, people in isolated villages, people who are poor, who can't afford any of this, how soon, rather, can we see improvement?
This meeting is first and foremost about those people who right now are left behind. Those who are poor, who live in remote communities, who don't have access to roads, who can't reach health centers, who can't even afford drinking water. Sanitation is not available to them. This meeting is first and foremost about those who are currently being left behind. We want to be able to walk out of this room tomorrow with strategies that will reach the most vulnerable, the poor, and those most in need in our continent. That's why we are here.
Thank you so much for joining us, Dr. Robailo.
Thank
Dr.
you.
Robailo there from she's the Director of Communicable Diseases for the World Health Organization here in Africa. Back to you, Beatrice.
Right, Ilonela Lipuan joining us there live from Kigali. Thank you.